During the actual birth itself, when the baby's about to be born, some women will need some help with delivering the baby's head. This can be for a number of reasons. It could be that mother is exhausted from the labour and is unable to push the baby out. It may be that you had quite a lot of pain relief if you had an epidural and just can't feel what you're doing, so you're not pushing efficiently. It may be that the baby's getting a little bit distressed at this point. Although we know that this is the most uncomfortable part of labour for babies, mature healthy babies are designed to withstand the pressures of labour. Sometimes, if the pressure of the squeezing on the baby's head goes on for a long time, they can start finding it a bit of a struggle. And in this case, women would probably need help with either forceps or what we call a von Teuse delivery. Which instrument or which way of helping the baby's head to be born is a decision that's made by the doctor at the time, depending on what the actual problem is. Either method can mark the baby's skin a little bit, but this is temporary. Most women are very frightened at the thought of forceps. Everyone has heard stories about how it damages babies and how it damages mothers. This only happens in rare circumstances. Forceps in the hands of an experienced obstetrician are not a risk to your baby. Women are much more likely to need an episiotomy if they have an instrumental delivery though. Forceps are actually designed to protect the baby's head, not to crush it. They come in two separate pieces, and once they're comfortably on the baby's head, then the handles are locked so that the cradle around the baby's head cannot be made smaller in any way, so it can't cause damage to the baby's head in those circumstances. You'll probably find your baby has some marks around the ears and around the temples from the forceps, because baby's skin is very, very soft and easily marked. These generally have disappeared completely within 24 hours and won't cause any lasting problems for your baby. Babies that are delivered by von Teuse cup, which applies suction to the baby's head, will have a cup-shaped swelling on top of their head once the von Teuse cup is taken off. Again, this is just fluid under the tissues, and within 24 hours that will have disappeared. It'll leave a little bruising on the skin, which can be a bit uncomfortable for the baby for a few days. Baby may be a little bit irritable, but no long-term damage will be caused to the baby by a von Teuse cup assisted delivery. Pain relief is always given to mothers for either forceps or von Teuse, and your hospital and your doctor will make sure that if you do not already have an epidural in place, that you'll have an instant acting anaesthetic that's given by injection around the site of the vagina.